Welcome to Counselor Soapbox video, learning about alcohol part 29, special populations. In this video, we're going to talk specifically about doing substance abuse treatment with adolescents. In counseling adolescents, you need to learn about normal development. Typically, girls develop before boys, and adolescence is the period between childhood and adulthood, which has been lengthening over the past few decades. You need to consider peer pressure, both resisting and giving in. A lot of people think the solution to treating drug addiction or substance use disorders in adolescents is to tell them to resist peer pressure. The problem with that is that all humans give in to peer pressure. We look around and see what other people are doing, and we copy that. So in working with children, young people, and peer pressure, you want to tell them to pick really good peers, because whoever they hang out with is who they're going to end up being like. Some normal developmental tasks can be challenging. Growing into your body, learning about sexuality, relationships, often differences attract, at least in the initial stage. Young people need to learn to make occupational choices, often without a lot of accurate information. They need to establish a social identity, and early in life you have to decide what you believe about religion and political affiliation. Some people simply join the same religion or political party as their parents. Others then go through a process of questioning this and having to make that decision for themselves. They also need to learn about independence, how to separate, hopefully how to separate from their parents without damaging the relationship so badly they never talk to those parents again. And there's a book called The Romance of Risk, which talks about how early in life, young people, teenagers and young adults, need to try new things they've never tried before. They need to take chances and undergo risk. What we want them to do is undergo the kind of risk like applying to a quality school, rather than the kind of risk like engaging in drug use or early sexuality. Drug and alcohol use looks differently in teens than it does in older adults. A lot of their use is experimentation, learning the rituals of how it's done, particularly with alcohol, the various drinks. It often starts out as fun, and early on there are few negative consequences for most. There's a lot of novelty and often new drugs, which young people are anxious to try. They're taking on adult roles, and drug use can slow this process. And there are both risk and protective factors which the counselor needs to consider and incorporate into their model of treatment. Adolescence and confidentiality is a particular issue for many counselors. There's the risk of taking sides, trying to get the young person to do what the parents want, or trying to argue with the parents over what the young person wants. You have to be careful not to take one side or the other. Parents often want to know exactly what their child is doing and what they're saying. The trouble is, once the counselor tells the parents one of the child's secrets, after that, that young person will not want to reveal anything more. And if you work for an institution, a school or criminal justice, they want to know what's going on and what the child is saying. So the rules of confidentiality can get very iffy. Part of informed consent is that the counselor should explain to a young person they're working with exactly what is and what will not be confidential before the young person has revealed their secrets. In working with young people, the counselor needs to consider both risk and protective factors. Family relationships may be either positive or negative, depending on the nature of the family's functioning. School performance also can have an impact on substance use. Leisure activities are important to look at. Some are more positive than others. Self-esteem is a major issue for many young people, for many people in counseling, period. Romantic relationships can either be protective or a risk factor. And healthy and risky behaviors. Smoking is definitely a risk factor for further drug use, and early sexual activity is also a risk factor for getting more involved with substance use. In looking at adolescent drug treatment, adult assessments and screens may be very misleading. You need to have instruments, forms made specifically for the population you're working with. Rather than asking about employment or job, you need to ask them about how they spend their spare time. Many young people have used substances but have not yet had negative consequences, and they may come to the program not wishing to give anything up. There's been a lot of research into what makes for a good treatment program for adolescents. Treat substance use disorder as a primary disease, not a symptom of something else. Look at all the aspects of teens' life and make referrals as needed for these other parts of their life. Abstinence-based, any use by a young child is abuse. You need plenty of knowledgeable staff, and support groups and self-help groups need to be appropriate for the age group you're working with. Adolescents should definitely be separated from adults. It's important that their family, however they understand that, and that may be foster care, maybe extended family members, or someone they're living with, but the family needs to be involved. There needs to be continuing and aftercare after they've completed their initial treatment episode in order to maintain whatever changes they've made. And you have to look at the rest of their life, their school, job training, all of that goes on while they're in treatment. Also, financial arrangements. Not every insurance company is willing to finance or pay for treatment, and you need to advocate sometimes for your clients. And good treatment needs to be close enough to home for the family to continue to be involved in the child's life while they are in treatment. Most adolescent treatment is done outpatient rather than inpatient so that they can go home and be with their families at night. Other issues to consider in working with young people: possible psychiatric disorders. It's likely that mental illness problems have not been diagnosed. Learning disabilities may often go undetected. Appropriate 12-step involvement. Many 12-step groups of older people will not feel comfortable to a young person. Unfortunately, we have to look at communicable diseases, AIDS, HIV, Hep C, those sorts of things. The counselor may need to be a community resource on doing a lot of things other than simply drug counseling. There are also special needs of minority youth who fit into other special populations in addition to being a young person. There's going to be more exposure to, more needing to work with homeless, runaway, discarded youth, discarded being told to get out even though they're underage. And there are often transitional age youth programs which try to bridge the gap between someone who is under 18 and then suddenly turns 18 and no longer has access to any youth services. Also, the counselor needs to look at the impact that smoking of tobacco and marijuana may have on the client's abuse of other drugs and alcohol. What's ahead on the Counselor Soapbox video channel? More videos on drug counseling, drug education, mental health, and wellness. If you've enjoyed this video, please click the like button below. Comments are always appreciated. And if you want to see new videos in this series, please subscribe. Thanks for watching. For more information, please visit my blog, counselorsoapbox.com. David Joel Miller fiction and nonfiction books are available on Amazon.